In rare disease settings, I'll take a step back. I actually think it's incredibly important that patients get seen at an academic center, not just to see an oncologist like myself, but to have the pathology reviewed. So we published a paper last year in mastocytosis showing that about a third of cases were missed. So for example, we looked at databases where a KIT mutation was seen. And then we went back, and even if the pathologist didn't identify mastocytosis, in a third of those cases that were missed, there was an SM diagnosis. So it's important to have pathology. And it's the same thing with BBDCN. Some cases are called BBDCN in the community, which are not. And some cases are called acute myeloid leukemia that end up being BBDCN. So having pathology review is essential. And then that leapfrogs into the idea of having therapeutic options for those patients, even if they get their therapy closer to home, but at least you know the definitive diagnosis, the accurate diagnosis, and one can employ some recommendations for therapy, either on trial, preferred, of course, but trials, especially during the pandemic, may not be for everybody, but at least the therapy can be guided closer to home. So I think it's hugely, and all three of those platforms are very important.